It's all about lifestyle changes. It's all about lifestyle modification, behavioral modifications, learning coping skills. Medication helps, but it's not the end all be all.
Welcome to Healthy Living, Wellness and Prevention, Medical Innovation, the informed side of care. Welcome to Baptist Health Talk.
Hi, everyone. I'm your host, Johanna Gomez. Welcome back to a new episode of Baptist Health Talk, where we answer your most searched questions on trending topics. Today, we'll be diving into a topic that social media, among many other things, has people questioning if they have a condition and just never knew it. They were exploring it with signs, challenges, diagnosis, and even hacks to manage it. We're joined by Dr. Rachel Rohaidy, neuropsychiatrist at Baptist Health Miami Neuroscience Institute. Thank you so much for being here, doctor. A lot of people have so many questions, and this really is like a buzzing topic. So before we get into it, can you just explain what ADHD is?
So ADHD is kind of a brain disorder we can think of not being able to pay attention, little disorganization. Sometimes there can be behavioral problems, which can be really found out in childhood.
Okay, so there is a difference, though, between kids that have ADHD and adults once you are diagnosed. Are
Yes,
there many?
There can be.
Okay, and why is it that people are missing that you're not getting diagnosed at a young age then?
So I think it depends on the age of the person.
Okay.
Because, about 20 some odd years ago or more, we didn't really know as much
Got it.
as we do now. And so we have the ability now to really diagnose properly and medicate properly.
Okay.
As well. I think years ago, we didn't, there were certain taboos to psychiatry, to diagnoses of brain disorders, and especially with medication. So I think now that we're more open as a society about it, I think we are a little more open to talking about it.
Is it safe to say, though, that every single person has a little bit of disorganization going on, and like sometimes life just kind of gets
Absolutely.
overwhelming at any age, by the way, with kids and adults? So how do you really know, like, okay, I could possibly have this ADHD diagnosis?
So with the diagnosis of a disorder, of any disorder, and it could be any psychiatric disorder, comes, does this thing that's happening to you interfere with your ability to move forward, with your ability to finish things, with your ability to work, to be with family and friends? So if it's something that is, you kind of suspect, but you're able to work, you're working well, you're doing fine, not that big of a deal. But once it starts really affecting what you're doing and affecting your daily life, then I would say that's a time to ask for help and to investigate a little more.
Okay, so we hear a lot about ADHD, but there's also ADD, and a lot of people either combine them together, thinks the same thing, while others are saying, no, it's actually two different things. Can you clarify that for us?
So the way I look at it is it's really the same. They're interchangeable.
Same family?
Same family, right. They're interchangeable, I guess, titles that we give it. There is a hyperactivity and there is an inattentive type to ADHD.
Okay.
But the verbiage is really interchangeable a lot of times.
So it's pretty much the same thing. It's just more like if you're either very hyper or not.
Right.
Okay. So it's
right.
But is it treated the same?
Yes.
Still under the same ADHD family?
They are treated the same. They have the same combination of medications and same kind of lifestyle modifications or lifestyle changes that you can do. Yeah.
So just a couple of weeks ago, Paris Hilton came out on social media. There was also Nelly Furtado. And by the way, just to name these celebrities, but there have been so many other and regular people that have said, I think I have ADHD, or I was just diagnosed with ADHD, and it all clicks. It all makes sense. If you weren't hyper as a child, right, and you missed those signs, and just like you just said, it changed, the signs, do they continue to get worse as an adult? So if someone's watching right now, they go, that was me as a child, and there's still a little bit of that in me right now as an adult?
So I think it depends.
Okay.
A lot of times we compensate for things. So I don't
Yeah.
think things necessarily get worse. I think we just learn how to manage as we go.
Mhm.
But let's talk about some of the symptoms.
Yeah.
There is a propensity for girls to be missed a lot more than boys.
Why?
So there is a little bit of a difference in sexes. So girls tend to be more of the inattentive type. So we're the daydreamers. We could be called lazy.
Wow.
Maybe we're, doodling and doing something else.
That could be considered artsy, right?
Right.
Okay.
So we're more of the inattentive. So we don't really necessarily behave badly. We're not jumping out of our seats. We're not hanging from a tree and getting into trouble. And so girls are often missed in that regard. Boys do have a tendency of being the hyperactive type. So they're talking a lot more in class. They're more rambunctious. They don't listen as well. They're the ones getting hurt because they're falling from trees and running into traffic. And so you notice the hyperactivity much more, right?
Okay.
So there's that difference.
Okay.
And I don't think any of these things get better as you age. And there was kind of a sense that it went away as you got older. I don't think it ever goes away.
It's something that you just deal with.
It's a disorder, right? And so it's something that you compensate for. And so if there are, let's say, young boys who are very hyperactive, well, maybe they go into some kind of job force where they're using their hands more, where they're outside more, where they're not sitting at a desk. And so in that way, that hyperactivity is kind of dealt with.
Yeah.
Right. So you'll see I see a lot of my patients who have changed their lives to help their symptoms. Right. So girls will tend to not lose things.
Okay.
Right. Because there's a place for everything, or they won't be as forgetful because they have to write everything down. Boys can get out that hyperactivity by playing sports.
Right.
Right. So there's things that we can do to compensate those symptoms.
Right. And as you get older, you probably go out a little bit more, work out, and you can figure out what works for you.
Exactly.
But you can still continue living life going, I have this and it's not my...
I'm behind the eight ball.
Can you live a successful, happy life without having medication?
Sure, absolutely. And
Okay.
I do have plenty of patients that do. It's just there's times where patients will come to me and say, well, I know that there's something amiss. And most often it's them saying, well, my son or my daughter has just been diagnosed. And as they're going through the symptom checklist, that was me. So I get a lot of that.
Is it genetic?
Absolutely.
Okay. So that's probably what I know you said earlier that you just it wasn't studied enough because there was a big taboo. Why having stars like Paris Hilton, Nelly Furtado come out? And by the way, not just them, all of us just having this conversation to normalize the condition of ADHD, ADD. Does it kind of make it easier for everyone?
Absolutely. I think now with all of these great platforms, TikTok and Instagram and all of these sort of things where we can have kind of an inside look into celebrities' lives. Mm-hmm. Now that they're talking about these things that they're going through, which we all go through,
absolutely,
we're able now to discuss them and look them up and find our groups or our people to help us through these things.
So what I am curious is, what was the turning point where you think in the medical field that they said, this needs to get checked? Because ADHD was not a term used when I was growing up. Yes, you had kids hanging off of the trees and girls that were doodling and all this and an organization, but you actually thought, well, you're a kid, right? What else is expected?
Right.
Where was the turning point that they said, this is what this is, attention deficit disorder, hyperactivity, and we've got to find a cure for it?
I think as the science has grown And as we've learned more about the brain, as we're talking about these topics more, I think all of that has helped kind of bring it out into the light. I remember, of course, more than 20, 30 years ago, we didn't have that many medications either to help patients. And now, almost every couple of months, there's something new. There's about 30 to 40 different medications to help, different formulations of medications. And again, it's through communication, through talking about it, that has helped bring all of this out to the forefront.
So I think it's very normal. If you have a child at school, a teacher or someone will say, you should maybe get your child checked to see if they have ADD or ADHD. So I think it's normal for kids to get tested. But as an adult, if you're in your 30s or your 40s, you're like, do I do it? And how beneficial is it going to be for me to get tested if I check all those boxes?
I think it just depends. I've had patients who come to me and say, I've not been able to move up in my company. I've been stuck in this position. And then once we actually get them treated, I've had a few females actually become managers and move up in their companies because they can finally kind of pay attention to one thing and get things done and organize themselves and not be distracted. And it's been life-changing for a lot of adults.
And is this something that you have to continue taking for the rest of your life, these medications? Or is it like, hey, we'll try it for a little bit, see how you feel. Maybe you can have some managing coping skills that don't require you to be on medication?
So a disorder is a disorder. And you're always going to have the disorder. And I tell this to all of my patients, there's no magic pill. Yeah. It's all about lifestyle changes. It's all about lifestyle modification, behavioral modifications, learning coping skills. Medication helps, but it's not the end all be all.
Yeah.
So and I think that's why I do like the fact that, everyone's talking about these things on TikTok because they're actually showing some, this is what's worked for me. And, doing these things, whatever they are, has helped me reach my goal without taking so much medication.
Yeah.
And that's helped a lot of my patients.
Yeah. So my nephew actually has ADHD. So I Googled one time on social media and I got all these hacks on how to live with ADHD, how to make your life a little bit easier. There are so many.
Yes.
Not all of them work for everyone.
Right.
Because it's exactly like you said, right? Every case is different.
Yes.
So you are the expert. What would you say is the number one hack right now or something that we should keep in mind of if you're trying to cope with this diagnosis?
Oh gosh. So for me, it's exercise. Wow. Exercise is medicine. So it's exercise, it's healthy eating, staying away from toxins. That's good. That for me is number one, and sleep.
Sleep. Yeah, but I'm assuming that your mind is just going if you have ADHD because you have so many things that you have to finish and you can't finish. So you have open tabs is what I like to call it in your brain. So
absolutely. It's sleep hygiene. It's learning how to sleep. It's managing those tabs. It's being able to, again, different behavioral modifications that help you. And they're all different.
Yeah.
But, these things take time. It's not overnight.
Right. It takes a lot of work to put in. For kids especially, how much the parents' organization or habits, I should say, how much does that have to play in with your child's being successful?
Huge. But I think that's for whether they have a disorder or not. Yeah. Absolutely.
Good point.
Right. Yeah. You are the example to your children. So that's where they learn, how to have relationships, how to deal with problems, when to stress, when not to stress. So they feed off of you.
Do you find it harder when a parent does not have ADHD or ADD and their child has it, which I'm assuming that is probably...
That can happen, yeah.
That can happen also. Do you find it that it's harder for those children to kind of cope with it?
I think it depends. It depends on the situation, but it can be.
Okay.
It can be, but parents are usually pretty good, and I don't usually treat kids. So, but I do know that parents are pretty good at finding those coping skills.
Yeah.
Whereas kids aren't out there looking for them. So I think the parents can really set a nice example.
Yeah. So COVID-19 pandemic, a lot of us, our lives were completely uprooted. We worked from home, no social. There was a lot of depression that came with that. And probably people were feeling a lot of things, a lot of those check boxes and things that are on the ADHD symptoms that you had mentioned early. Is there a correlation with not COVID, but what we went through with the lifestyle of living through a pandemic
Oh,
with
absolutely.
ADHD?
Absolutely. The isolation, having to look at a computer screen for a lot of us that didn't before,
Yeah.
having to sit in one spot alone where a lot of us didn't have to before. And like you said, a lot of the depression came up. So we know that anxiety disorders, depressive disorders, a lot of times can look like symptoms of ADHD, the inability to sit still, the inability to focus, inability to have recall memory. So a lot of these things can look like other things.
Got it.
Right.
So how do we know when it's that one thing?
It's just about, does this thing affect your daily living?
Right. Is it stopping
affecting-
you
Right.
from being
Is it
productive?
interfering? Right. And if it is, then it's worth, going to your primary care. What do I have? These are the symptoms. These are the things I'm concerned about, and having those open conversations.
Right. You mentioned earlier the difference between boys and girls with ADHD. Are there many differences between men and women that have ADHD that
They're
look completely
similar.
Very
Yeah,
similar.
Very similar. Yeah.
So nothing looks different at all.
Not necessarily. Again, mainly boys who become men will turn, still will have that bit of hyperactivity going. I'm not saying girls absolutely cannot, but there's more of a propensity for boys. But no. Actually, they're going to be almost similar symptoms.
Yeah.
Mhm.
What is your hope for someone that is watching right now, and you as a doctor, really, to say that you want for ADHD?
Oh gosh, to normalize, and that it's okay to take medication.
Okay.
Everyone has not everyone, a lot of people have this kind of block when it comes to, oh no, not medication.
Yeah.
But medication has been very helpful to a lot of people.
Well, I think it's because of the simple fact that we were kind of trained, like you took a medication when you weren't well.
Right.
Right. And that is admitting to, I'm not doing well, which I think is probably a very hard step
Right.
for a lot of people to have to deal with.
Absolutely.
Yeah. But you are normalizing it right away.
Yes.
Right now. By
Yes.
having this conversation
Absolutely.
with us right here, you're doing just that. Thank you so much. It
You're
really
welcome.
has been
Thank
a
you.
great, informative conversation. I learned a lot. Hopefully everyone at home learned as well. So thank you so much. Be sure to hit that subscribe button to all our viewers out there on our channel here to keep up with the latest health and wellness information and tips from our experts. Thank you so much for watching, and be safe.
Find additional valuable health and wellness information on our resource blog at baptisthealth.net/news. And be sure to interact with us on our social media channels for live and upcoming events. Baptist Health Talk is brought to you by Baptist Health, the warmer side of care.